Hi, Dr. Allie here with Metaphysical Therapy. Today I'm going to show you how to do a almost full body manual lymphatic drainage. This is great for pre-surgery, post-surgery. Slight disclaimer, it does not take the place of having somebody else do a manual lymphatic drainage treatment for you. When I do the treatment for you or another practitioner does the treatment for you, they're doing the whole body, and there are some limitations when you do it for yourself where you can't get the back parts, for instance, and the legs. It's just not quite as effective. But this is good in a pinch, and if you're like me and you like to do things yourself and have cheap health care, I get it. So we're going to start laying on our back with one arm. Well, the arms will be up when we get to that point, but we're going to start with the clavicle. So the clavicle is this area here, and usually you want to get skin on skin, flat palm with your knuckles right about at the clavicle, and push back and in towards your neck, and then release. Back in towards your neck and release. It's a circular motion. You're going to do this 9 times right above and below the collarbone. We're using lots of contact with your full hand and light pressure. The light pressure is important. The lymphatics are just under the surface of the skin, and they don't require a lot of pressure. In fact, you can inhibit the process if you push too hard. So pushing back in and then to the other side or towards the neck. So you're going to do 9 times on this side and 9 times on the other side. From the clavicle, that's number 1, we're going to go to the neck, the side of the neck. That's the same type of contact, just under your ear, behind your ear. Push back, down, and then towards the front and release. Back, down, towards the front and release. I'll show you from the other side. I kind of have to get under my earring a little bit, but I want broad contact here. Gentle push, back, down, and release. A nice circular motion with very light pressure, but a lot of contact. Skin on skin is best for these techniques. After the neck comes the armpit, and this is where you're going to raise the arm up. You can tuck the hand underneath your head if you want. And this hand, again, nice broad contact. So I usually kind of keep my fingers flat and wide. And I'm going to push down towards the back of my body, circle, and then pull up. Down, circle, and pull up. And you can put your hand kind of right up above the armpit, as well as right kind of in the armpit. This is an excellent technique for those who have had mastectomies and need that lymphatic flow to assist if you have only some of your lymph nodes left or even no lymph nodes. This is a good technique. So 9 times on this side, and then switch and do the other side, the other armpit, 9 times. So far we've hit the clavicle, which is the main drain, the neck, and the armpits where there are lymph nodes. We're going to the next set of lymph nodes in the groin. So legs out flat. You're feeling for that crease where the inguinal ligament is, right in the groin. And you just put your hands flat, push them in, up, out, and release. In towards the middle, up towards the belly, out, and release. Now I'm doing this over clothing. So ideally, I would have a little dish of water right next to me so that I could dip my hands, get a little water on my hands, and then my hands won't slide on my clothing. You don't want your hands sliding on your skin or your clothing. You want that you want it to remain in contact, and you're actually stretching the skin and moving the skin. As soon as we do the groin, then we're going to do some deep breathing to stimulate the cisterna-chyli in the abdomen. So belly rises on the inhale. Exhale, belly falls. If you want to expand that inhale, you can pull your belly button in towards the floor on the exhale. Excuse me. It's getting my throat going. Inhale, exhale, pull the belly in. 10 deep breaths. This is a good time to do that. And exhale. You can do the breathing throughout the whole process if you want, or you can do it right after we stimulate the 3 main lymph node areas. Next, we're going to go across the chest. Again, it's better skin on skin, but if you're going over clothing, you want just a little bit of water on your hands. And so you're going to go come up and over at armpit level, up and over, across the chest to the middle, and then the other side. Up and over, up and over, up and over. Moving the skin. So these are like little half moons. Up to one side and down. Little crescent moons. So 9 times across the chest, one direction, from one armpit to the other. And then switch hands. 9 times across the chest, the other direction. Good. So we've done 6 different areas. Number 7 is from the armpit to the groin. This is a diagonal motion. It is not straight down your side. It goes from the armpit with a circular, Mecca's helping me. Move out of the way, baby. From the armpit with little circles this way, and again, a little water on the clothing, kind of like on the rib cage right under, and then the belly, and then right at the groin on that same side. I'm working my left side, so I'm going to do this 9 times from the armpit down to the groin, and then you can switch to the other side, or you can do 9 times from the groin up to the armpit. You can see my hand is kind of sliding on my clothing, but that's not ideal. Ideally, I would be skin on skin for these techniques. So 9 times up, 9 times down on each side. Just following that. I mean, it's kind of like right where you can reach comfortably with your hand. If you're having to really stretch your reach, then you might not be getting the right angle to it. So that's the armpit down to the groin. And now we're going to go across the lower abdomen. Same technique. Up and over, up and over, up and over. 9 times across from right to left, and then 9 times across from left to right. So the problem with sliding on the clothing is that the temptation is to push harder. So if you use that little bit of water on your hands, or you can use hand sanitizer or a lotion or something like that, that works too. So 9 times across here, 9 times across that way. Now for those who are dealing with lymphedema in the arms, then we can start working the fluid up the arms. Now that we've gotten the the main highways cleared. After the lymph nodes, we're going to work the arm. So just rest it on your tummy and do that same. It's a similar technique, but it's not quite so circular. You put your hand down with lots of contact on your arm, and then you gently start to just sort of push the skin up towards the shoulder. So start down at the wrist, come up to the elbow, and then up the arm that way. And you can try to get different parts of the arm. You can open the arm out like this and work this side of the arm too. But so 9 times up this arm, and then 9 times up the other arm. Nice. So that is pretty much the main gist of it for the lymphatic drainage for nearly full body. We didn't do legs. This is mostly designed for like mastectomy type patients and upper body. So I hope this really helps you with your manual lymphatic drainage. Thank you so much for watching, and please tell your friends.